little bit. That's 19, but that is over 3 days. So I feel like it's steady as she goes here. We're looking for any sharp breaks. We've talked a lot about hospitalizations. So Josh put this chart together. Here's what it says to me. That top line is the yellow line. Those are hospital admissions. Blue are those who are being discharged, and unfortunately the red are the fatalities. What it says is you'll see the number of hospital admissions was up a lot in mid-January, got close to 200. Now we're down at about half that number, more like 100 or so. And these tend to be a little younger people and probably a little less sick. Back 8 months ago, they're older people and a lot more sick. One thing that means, even since January, that red line at the bottom, the fatalities, tragically, about 15% of the people didn't make it out of the hospital. And today, that's only 5%. So you get an idea of how it's relatively healthier people, a little less at risk, a little less time in the hospital. It tells you a little story about what's going on in our hospitalizations and our additional capacity there. Look, on a happier note, here's the vaccine update. I consider this pretty good news. Despite a hiccup with J&J last week, our doses have continued unabated. We're going to have 288,000 additional doses delivered this week. That's 288,000 additional appointments you can make. So don't hold back. The vast majority, 2/3 plus of the people 45 and above have now been vaccinated. And Scott was saying it's obviously a much higher number than that who have some sort of antibodies given the nature of the infections that we suffered, especially going back some months. 45% of all adults have been vaccinated. But we still have a way to go with the 16 to 45-year-old age group. They've only just opened up, and that's about 18%. So what has this said to me when it comes to our reopening strategy is that places that are more oriented towards an older demographic, say restaurants before 11 o'clock, say retail stores, say houses of worship, we've got them open and no plans to turn that back. I think more and more of the people going there have been vaccinated, have the antibodies, and can wear the mask safely. I would tell the group, the younger demographic, say 20 to 30, we still have to think about bars. We still have to think about concert venues. We'll be given some guidance on that in the next couple of weeks, but get vaccinated. Get vaccinated now. There is capacity, and that will make our decision-making a lot easier. I think we can give you some guidance at this early stage that we anticipate at this point, unless something changes dramatically, that there will be outdoor parades, that there will be outdoor graduations, and even indoor graduations wearing the mask if there's inclement weather. I know that's important to a lot of you as you want to plan ahead, plan on it. This next chart, protecting the most vulnerable. That green line is the 75 and above. You can see they're over 80% of them have gotten vaccinated. 65 to 74 took us, almost another month before they were added, but you see where they are going forward, what a difference that's made. And go right through to 45 to 54. You can see how they're ramping up. I'm really pleased that they're getting vaccinated with some urgency. There's no slack in the system at this point. And the 16 to 44, you see we hope to get to 40% of them vaccinated within the next week and 60% vaccinated within the next couple of weeks, which is why we feel that by the end of April, we'll be in a very different position, and hopefully a more confident position, what we can expect for the future. Folks with developmental disabilities, you know that we paid special attention there. Obviously, nobody is being turned away due to age. That's opened up now since Thursday. But more importantly, like a lot of our underserved communities, we're bringing the mobile vaccination vans to you. We're bringing the mobile vaccination vans to the communities with disabilities, often folks who are at some risk, often folks who can't go to that drive-through clinic. we just read this note. It meant a lot to me. I'd like to compliment the efficiency and comfort of the Kennedy Center, the vaccination clinic this past Friday. There's always a comfort when you go to a place that may be stressful for our loved ones and end up seeing so many friendly and familiar faces. So we've got close to half of the folks that had not been vaccinated now vaccinated in the developmental disabilities community. dds.covid19@ct.gov. That's where you go. We'll get the van to you or make that appointment, make it easier for you to get your loved one vaccinated. And finally, talk about getting easier to get vaccinated. These are our vax vehicles. We got these going out on the street, 35 of them this week, going to be out there. I think they're kind of easy to find from a distance. And some of them right now have walk-up capability, but get an appointment. That's a lot easier. They're going to be widely available all over the state. And like I said, very soon there's going to have an ice cream truck type mentality. You'll be able to walk up and get a vaccine. We've also rolled out to hundreds of pharmacies across the state right now, not just Walgreens and CVS, but across the board, including our independent pharmacies, where our very own Chief of Staff Paul Mounds was vaccinated this morning. He's feeling a lot better, feeling pretty confident. Primary care pharmacies across the board, being able to increasingly get people vaccinated there. And again, I'll leave you with the thought that we're still going to focus on the younger demographic, 16 to 45. In particular, we're seeing some flare-ups in and around the college-age population, high school sports. We used to be out there trying our best to protect the seniors. Now we're also going to do the best we can to protect the younger. So for high school and college base, we're going to bring the clinics. We're going to be bringing the mobile vans to you to make sure that you can get vaccinated safely and we can keep this school year going, or the college kids, they can get home safely. With that, we've got Josh and Paul. And as I mentioned before, Scott Gottlieb. Thanks, Scott, so much. Appreciate you being here to answer any of your questions. If you want to know about the B117 variant versus the New York variant, Scott's your man. If you want to find out about vaccine validation, some of the different strategies out there, Scott's your man. Scott, as you know, is on the board of Pfizer and pretty authoritative on all the vaccines and their efficacy against these different variants. So with that, love to take your questions.
Channel 3 Eyewitness News.
Yes, a question for Dr. Gottlieb. How do you see the virus progressing in our state, especially when it comes to the most vulnerable population? Do you feel like we're at a point right now where we can open up further because we've given every eligible person the opportunity to be vaccinated?
Look, I think that this month we're going to see a tipping point. The bottom line is because the vaccination rates among 65 and over are frankly among the highest in the nation. We've had really good penetration among the elderly population, which is the most vulnerable population. We're going to have more opportunity to lean forward. I think that you're going to see, hopefully, a situation over the course of this month where you really start to see cases decline, hospitalizations decline more dramatically. If you look at what happened in Israel, Israel started to tip over in terms of starting to see declines from their vaccination campaign when they reached about 26% of their population penetrated with vaccine. We've crossed that nationally. We crossed that a while ago in this state. And so I think you're going to start to see the declines accelerate in the state. And my view has been all along that as we get more of the vulnerable population vaccinated and get some more immunity into vulnerable people, we can start to take more risk with what we're doing. We're never going to get to zero COVID. COVID's always going to circulate. It's going to be a fact of life probably for a long time. What we want to do is try to get enough immunity in the population, enough protection to the vulnerable population that we could take more risks in terms of what we're doing in our daily activities. And I think we're going to be at that point this month.
Thank you, Doctor. And a real quick question for Governor Lamont. Last week, if my numbers are correct, 24% of our residents were fully vaccinated. At the end of May, where do you see our state when it comes to fully vaccinated residents? And what is the target for herd immunity in Connecticut?
I'll start. I think Josh estimates that we ought to get about 60% of our people vaccinated by the end of April, or even a little sooner than that, in the next 2 weeks or so. I think that'll be a tipping point there. As you know, a fair number of people were previously infected, probably in a very mild way, asymptomatic way, but they do have some antibodies. So we are not at herd immunity yet, but we're getting closer. Young people, get vaccinated.
Thank you.
NBC Connecticut.
Governor, I just had one quick question. Have you reached out to any Georgia companies and asked them if they want to actually come to Connecticut, where we are in the process of expanding voter rights right now? I know that was a topic of conversation last week in relation to the legislation that was presented in Georgia.
What type of companies did you say?
I was just asking if you have heard from any companies about possibly coming to Connecticut, or if you've been in any conversations with some of those.
I haven't had those conversations with any of those companies. But look, I think Major League Baseball did the right thing. I think I'd love to see the corporate community standing up. I think we ought to make it easier for people to vote and have a stake in the elections and have a stake in the outcomes. So, and I think I think we all are here in Connecticut trying to do more to make it easier to vote with integrity. I think we did that pretty well during the last election. I want to do that again.
I got you. And just to confirm, you have not reached out to any of the Georgia companies. Is that correct?
That's correct.
News 8. News 8. Fox 61.
Sorry, Max. Max.
Go ahead, Rich.
Sorry about that. For Governor and Dr. Gottlieb, I've been reading some articles where doctors have expressed concern that great that vaccinations are up around the country, but as that has happened in a lot of the country, the testing for COVID is down, and that there are then concerns with that. So I guess twofold, do you see that happening around the country? And is that kind of happening here in Connecticut, where maybe the testing for COVID is down a little bit as we try and get as many people vaccinated?
Yeah, I actually don't think testing's down. I think testing's up. I think what's happening around the country is that more of the testing is shifting to antigen-based tests that are being run in austere environments, schools, workplaces, even doctors' offices, where the results aren't necessarily getting reported. I mean, I think earlier in this pandemic, the negative results were more consistently reported. I think what's happening right now is a lot of antigen tests are getting into the hands of folks who aren't necessarily consistently reporting negative results, including consumers who are testing at home. But once you get a positive result on one of those antigen tests, typically someone will reflex to PCR, and in that PCR result will get reported. So I think that there's a possibility that we're actually overstating the positivity rate, not understating it, or because we're actually doing more testing, and what's getting reported are more of the positive tests, and what's getting underreported are more of the negative tests. Because there was a statistic out from the federal government recently trying to estimate the number of antigen tests that are being done that aren't getting reported, and they put it at around 3x, if I remember correctly, the data. I don't believe it's that high, but I think that there's a whole lot of testing going on that's not making its way into the system right now.
And for Governor Lamont, with school districts, you just talked about the possibility of outdoor graduations going on, and if they're indoor, then with masks. What about with, say, prom season is coming up? Is that an area where you might go with the leaving up to each district, or will you make a determination similar to what you'll do with proms, or similar to what you'll do with graduation, rather?
Well, I think graduation, primarily outside, everybody wearing the mask, I think you can count on that. I'd like to think that we're going to give you clear guidance on proms within a week or so. If you're going to school, you've got your cohort of friends. I'd like to think we can have a nice prom this spring. But let us watch the numbers just a little bit more carefully and get back to you within a week.
Thank you.
Fox 61.
Hi, I just have a quick question for Dr. Gottlieb. Could you talk to us a little bit about this new double mutant COVID variant discovered in San Francisco area? Do we have any information on this? And then any concerns, obviously, with that popping up here in Connecticut and our current COVID vaccinations working against this?
Yeah, I don't have a lot of. I saw the headline cross today. I don't have a lot of information about that right now. I think what you're seeing with these new variants is you're seeing what we call convergent evolution. So it's not necessarily the case that something originates in one part of the world and then it slowly propagates around the world. This virus is mutating spontaneously to develop these now what we are recognizing as these more common mutations, like the E4A4K mutation, the one that you see in 1351, the South African variant, and that you see also in P1, the Brazilian variant. So this is kind of happening spontaneously in different parts of the world. It's just kind of growing up as the virus in different parts of the world figures out how to incorporate some of these mutations. So you're going to continue to see this. You're going to continue to see new strains emerge that incorporate different collections of mutations. And I think one of the things we're going to start doing probably pretty soon is thinking of these new variants not necessarily as the UK variant or the South African variant, but we're going to start to classify them more by the mutations that the variants contain rather than the strains themselves. And the 484K mutation being the one that is causing a lot of concern because it appears to have the potential to reduce the effectiveness of prior immunity, including through vaccination.
WTIC 1080 News.
Hi, Dr. Gottlieb. Just wanted to ask you for comment on how the messaging is going, getting the word out that everyone should get vaccinated. One of the headlines in the Times this afternoon is white evangelical resistance is an obstacle in the vaccination effort. So it seems like there's a lot of different demographics which are still opposing the vaccine.
Yeah, what worries me is that as you get into the younger demographic, you're not going to have the same brisk demand that we saw among older individuals. I think that there was a lot of demand among 65 and above. And when you get into 20-year-olds and 30-year-olds, you're not going to see the same level of demand. It's going to be harder to get the same level of penetration. And look, if you look at flu vaccination rates, it's sort of a barbell. You see brisk uptake among the young because we require vaccination among children, and you see brisk uptake among the elderly because they recognize that they're uniquely vulnerable to influenza and they go out and get vaccinated every year. And then you don't see a lot of vaccination in sort of the 20 to 45-year-old demographic. And I think as we get into that demographic now, and eligibility expands, I worry that the demand's not going to be there. And we're going to really have to work at it trying to get 20-year-olds and 30-year-olds to take the vaccine. They should get vaccinated. They're at less risk from the virus, but they're not risk-free from the virus. And I think everyone should get vaccinated. They also should get vaccinated because they could be asymptomatic carriers of the virus and put other individuals who are at higher risk, at risk of a bad outcome of getting the virus and having a bad outcome. So we're going to need to work hard to get that age demographic, in my view, vaccinated.
You've said a bunch recently that the next few weeks, hang on a few more weeks and all that. We're seeing a spike in Michigan. We're seeing the regional spikes in Europe. It's a repetitive question, I guess, but how concerned are you that we're going to get a spike like that here? Yeah,
I think it's unlikely. First of all, I don't think we're going to have a true fourth wave of infection that's going to sweep the nation nationally. I think that what we're at risk for is some regionalized epidemics or outbreaks like you're seeing in Michigan that's centered largely around the metro Detroit area. I think that there's enough immunity in the population here in the tri-state region that hopefully what you're going to see is maybe a plateauing over the next couple of weeks, and then we're going to continue to book declines in cases heading into the summer. I'm hoping you don't see a big uptick. And I think the reason why you haven't seen consistent declines in the Northeast and in Michigan, Minnesota, Massachusetts that you've seen in places like Texas and Southern California and Florida is, B117 got in here a little earlier, so I think it's a little bit more prevalent here like it is in Massachusetts and Michigan. I think that we haven't had the benefit of a seasonal effect yet. I think in places like Massachusetts and Michigan, where you see the biggest growth is among age 10 to 19. Part of that's explained by the fact that they reopened schools. And so you're seeing outbreaks in a school-age population. Social networks that were largely sheltered from the vaccine through most of the pandemic are now being sheltered from the virus, are now being exposed to the virus. So I think that explains a lot of what we're seeing. And hopefully, as the weather warms here, more activities get moved outside, vaccination continues to increase. I think you're going to start to see some of the gains get consolidated, and we're going to start to have more declines here in the Northeast. The one thing that can pierce that narrative is if these new variants are piercing prior immunity. If people who were previously infected, particularly in the spring, when a lot of the infections swept through the Northeast, are now vulnerable to reinfection, or if people who've been vaccinated are getting reinfected. Now, on the vaccine, we don't see that, and we're doing a pretty good job looking for that because we're following the patients who are in the clinical trials. So I think if there was large-scale infections happening among the vaccinated population, we probably would be detecting that at this point. With respect to people who've been previously infected and whether or not they're getting reinfected, we don't think that's the case, but we aren't doing a really good job looking for that. Probably some of the best data is coming out of state level and city public health departments. I look at the New York City data. They've sequenced about 7,000 cases right now. About 1,800 of them are 1526, the New York variant. About 600 of them are B117. And if you look within that population, you're not seeing a lot of people who were previously known to be previously infected getting reinfected. So it's somewhat reassuring, but we don't have really good national consolidated data looking at whether or not there's reinfection going on. Again, I don't think it's happening on a large scale. I think we would have detected it, but that's the only thing that could potentially pierce the narrative that after another 2 or 3 weeks, we're going to start to see declines again. And I think the overall picture is going to start to improve quite dramatically. We really just need to get through the next 2 or 3 weeks. Vaccinations are picking up. I think by the end of April, things are going to look markedly different. I think the fact that, we've sort of re-engaged in a lot of activity a little earlier than we perhaps should have, probably delayed the point at which you're going to see an inflection point in this epidemic, but it hasn't foreclosed that. I think we're still going to realize that opportunity.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Dr. Gottlieb, last week, Angela Huang from Pfizer said that the need to boost is in our reality, and she mentioned it might be even after 6 months. Do you agree? And if so, when might we start talking about booster shots? And are you concerned at all about the prospect of having to persuade people to even get a booster shot?
Well, look, we're going to have the data from those trials. There's a trial underway looking at a third dose of the existing vaccines. Both Moderna and Pfizer are both looking at that. I think J&J is looking at a second dose of their vaccine. There's also trials underway looking at new variant vaccines, particularly against a strain that is closely resembling 1351, the South African variant, to see if a booster with a new variant vaccine affords additional protection. So I think that that's going to be the question, whether or not an additional dose of the existing vaccine versus a dose of a new variant vaccine, which one's affording more protection, and whether or not it's unmasking more vaccine-related side effects. So we'll have the data to answer that question. I think it's quite likely that you're going to want to give another dose of vaccine, at least to some portion of the population heading into the fall. Remember, we vaccinated the most vulnerable portions of our population, people in nursing homes, people over the age of 70, in December and January for the most part, and a little bit into February. So come, September, October, they're going to be almost a year out from vaccination. Now, if you believe that there is going to be some decline in the protection over time, which we've now seen in the clinical data, there is some decline, not a lot, but there is some decline in the protection over time. You're probably going to want your vulnerable population to have maximal immunity heading into the sort of winter 2021-2022 COVID season, and that would require them to get a booster with a third dose of the vaccine. So I think if the clinical trial data looks strong in terms of that the third dose is affording extra immune protection, which it should, and that people aren't becoming hyperstimulated, they're not having vaccine-related side effects with a third dose, I think you're going to want to get a booster at least into the vulnerable population heading into the 2021-2022 COVID season. So I would expect us to lean in the direction of doing that clinically. Whether or not you're going to provide a booster to a younger population, I think that's an open question, because remember, a lot of younger people will have been vaccinated closer to the fall-winter season, so their immunity will be more fresh. they're more likely to derive a stronger immune response from vaccination. We've seen that in the clinical data. So I think that's still an open question.
Thanks so much. And Governor, that begs the question, is the state of Connecticut working with the nursing homes to try to plan for the possibility of booster shots?
Yeah, so we are thinking about that. In the meantime, we're trying to get back to the nursing homes on a regular basis just to take into account all the new residents maybe who've moved in over a course of a period of time. We found that could be a bit of a leak in the vessel. But we're going to be thinking about that for the fall and probably working with Scott Gottlieb on that.
And one quick question. You had a line in your daily briefing last week about how Connecticut's vaccine supply could exceed demand by late April. Is that when you think we would have about 60% of the state vaccinated?
I think that's right, Sue. Look, this is just a guesstimate at this point, but over the next 2 to 3 weeks, we'll have 60%, as you heard Scott say. I got to see what the uptake is for younger folks, say 20, 30-year-olds. And we're going to have to work especially hard. That's why you see those mobile vans going out to make it easier for you to get vaccinated so we can get up to 70, 75%.
Great. Thank you very much.
The Waterbury Republican American.
Thanks very much. This might be a question for Scott Gottlieb. Will Pfizer and Moderna always require 2 shots? This is a question from one of our readers.
Yeah, I mean, it's an interesting question, whether or not they're going to continue to be 2 shots in the future, or whether or not you can just, if they do end up being an annualized vaccine. I think for the foreseeable future, that's probably going to be the case. We're probably going to, require seasonal vaccination in the same way we do for flu. Whether or not you can just have a single shot as a booster year out, that will probably be the case. In terms of just the if it's more of a question around a formulation, and will the formulation be optimized to try to deliver this as one dose? It's possible. I mean, those are the kinds of things you're going to work on when you work on a 2nd generation and a 3rd generation vaccine, are trying to make it more commercially attractive. So how do you make something more commercially attractive? Well, 1 dose is better than 2 doses. You don't have to bring the consumer back. Trying to get into a formulation where it's stable at room temperature, so it can be kept on the shelf of a doctor's office for a longer period of time. Those are the kinds of things you want to do if you're trying to optimize the vaccine. Now, these vaccines weren't necessarily, from just a sort of the formulation standpoint, you didn't optimize them because they were put into development very quickly. So it needs to be stored at a cold temperature. It's 2 doses rather than 1. So those are the kinds of things, if you're trying to innovate and to make something more commercially viable, more attractive to consumers, those are the kinds of attributes that you would work on.
Oh, thanks very much. Governor, I'd like to follow up on Sue's question. Of this 60% who will be vaccinated by the end of April, do we have an idea of what percentage will be of our population will be fully vaccinated, meaning they've had a single shot of the Johnson & Johnson vaccine or a 2nd shot of the Moderna and Pfizer vaccines?
Want that one, Josh?
Sure. So again, our modeling, as the governor pointed out, assuming demand remains robust, as we hope and expect that it will through the month of April, we should be at about 60% of people having received their first dose by the end of the month. Keep in mind, that still includes, a significant portion of the population younger than 16 who's not eligible. So just looking at the eligible population, 16 and above, we think we could be close to 3/4 of the entire population with their first dose by the end of the month. Now, with regards to 2nd dose, that will trail those percentages by probably about 10 points or so, but on a temporary basis until you get to that 2nd dose for Pfizer 3 weeks later or Moderna 4 weeks later. Johnson & Johnson is increasing as a percentage of the total rapidly. Obviously, that once you get the first dose there, you're fully vaccinated. So there won't be a huge time lag there, Paul. So we're going to be getting to some very high numbers of the percentage of the total Connecticut population vaccinated by the end of the month.
And could you or the governor perhaps provide us a little more information about what's going to be happening with the 35 vans that are going to be mobile vaccination vans that are going to be rolling out this week? Where are they going? I assume it's some SBI communities are going to be targeted.
Yeah, certainly to start, they're going to be heavily targeted into our higher SVI communities around the state, particularly in our cities. And the scheduling is going to be done in cooperation with our local health departments. We're going to be working with them, similar to what we've been doing with the FEMA mobile unit, to look at the communities where the vaccination rates are trailing, the best places for those vans to be located, and then working with our local community partners to drive awareness and outreach to make sure that when they show up, people know they're going to be there and they turn out in big numbers to take advantage of the opportunity. So it's, as has been the case in our cities, it's all about local partnership, working with our local leaders there to put them in the right place and then get folks to turn out.
Okay. And Governor, could you elaborate a little bit more on this leaky vessel analogy you used regarding the nursing home population, and maybe could flesh out a little bit, or you or Josh could flesh out a little bit more of what exactly is going on in your discussions with the nursing home industry about next steps?
I don't think that was a very good analogy, Paul, but there are a fair number of residents that come in, every week and every month, and there's some new employees as well. So we've been thinking with the White House about how we make sure we go back for a refresher to nursing homes, not, as Scott said, just at the end of 9 months or a year, when maybe some of the vaccine is not as effective as it was before, but on a more regular basis than in the nursing homes.
Yeah, so to provide a little more context, as the governor mentioned, about 5% of the nursing home population in the state turns over each week. So that accumulates quickly. And what we were seeing probably a month or month and a half ago was that people coming in were not overwhelmingly vaccinated. And so what we've done in the short term is we've deployed National Guard resources to go in and do vaccinations of those unvaccinated new admissions. But in the meantime, we've also been working with our acute care hospitals to make sure that they're vaccinating on discharge people headed towards nursing homes, as well as making sure that all the nursing homes have a vaccination partner established, a pharmacy or another partner, to make sure that that's being done on a sustainable, ongoing basis going forward. So we think that we've got that well covered at this point.
Okay, thanks very much. That's it for me.
Hearst, Connecticut Media.
Good afternoon. Do you expect the supply of vaccine to stay around that 288,000 first dose level in the coming weeks?
Want that, Josh?
Yeah, we based on what we've been told so far, we expect it to go down somewhat next week, based primarily on Johnson & Johnson supply being lower next week than this week. This week is an exceptionally high week for J&J. But that's what's baked into our models going forward. So this could be a high watermark for a couple of weeks, probably getting us through the month.
So then you expect sort of demand to drop off around that same time?
Yeah, exactly.
Thanks.
The Hartford Courant.
Hi, this is Eliza Fawcett from The Current. Just had a question for Dr. Gottlieb. What is your response to the CDC director's comments last week describing a sense of impending doom as COVID cases rise in parts of the U.S.?
Well, look, I think that this is a difficult month because we're going to see cases are rising in some parts of the country. I think we're seeing a plateauing and maybe a small uptick in parts of the country that we're seeing steady declines. I don't think that this is the beginning of an upsurge nationally. I think there's going to be parts of the country like Michigan where we're seeing pretty difficult situation in terms of cases rising. I think that they're at the point where they are in a full-blown epidemic right now. We need to try to take some steps to tighten up there. I think that we should be putting additional vaccine into the Metro Detroit area. I think that the federal government should be looking to target hotspots with additional vaccine. And they may have to pull back. They may have to tap the brakes in terms of the mitigation in that part of the country and other parts of the country. We're seeing these hotspots spring up. But I don't think that this is the beginning of a national trend. I think that we're going to consolidate the gains that we've made. We may see small upticks in certain parts of the country, and then we'll see continued declines as we get more vaccine into the population, as we get into the warmer weather, more activities get moved outside. We have more of a benefit from the seasonal change in the country.
Thanks. I mean, it sounds like there are these, two competing narratives right now, one being hope about the vaccine rollout and how effective that's been, and the other being the continued threat of the pandemic. Do you find that you lean more toward hope?
Well, I think that I think we've crossed an inflection point, and these next 2 or 3 weeks are going to be very difficult because, there's going to be points in time when it doesn't look that great. We see upticks in cases, hospitalizations might bump back up. I don't think that that's necessarily the beginning of a new trend nationally. I think that certain regions are going to have, spikes, and certain regions right now have a level of infection that's going to be hard to reverse absent some kind of intervention. But for most parts of the country, I think the continued outlook is good. Look, we re-engaged in activity a little too early. March was really a month when we needed to continue to do what we were doing in February, and we started to go out more and we started to socialize more. If you look at activity at TSA checkpoints, in a normal early April, you used to see back in 2019, you would see 2.5 million people nationally going through a TSA checkpoint. In this April, you saw about 1.5 million, mostly leisure travelers because business travelers haven't returned. That's a lot of people going through TSA checkpoints. I mean, if you think of last April when we were largely shut down, the number of people going through TSA checkpoints was about 100,000. So if you look at the Google mobility data, you look at the trends in retail outlets and grocery stores, it's gone back up again. It started to go up again towards the beginning of March, end of February, and it's continued to trend back up. So people are out and about again. I think that that's just a reality. And so what's the consequence? The consequence is we have more infection right now than I think many of us wanted, certainly, and many of us thought we'd be seeing right now. But again, I don't think that that's going to reverse the national trend. I think we've just sort of, bought ourselves another 2 or 3 weeks of a plateauing or a small uptick in infections before we start to see steadier declines on the back end of this. As we get more vaccine into the population, as more activities move outside, and so you get a benefit of being outdoors where there's a lower risk of transmission.
Given what you just said, do you think Connecticut should have held off a bit on its reopening?
No. Look, my view is that policymakers, with all due respect to the governor, policymakers end up fashioning policy that has to conform to the aspirations of people and the aspirations of the governed. You can't be that far out of step with what people want. You've got to try to fashion policy that conforms to a degree where the public mood is. And the public mood was in a place where people wanted to start returning to some semblance of normalcy. And I think trying to provide a glide path to do that in a responsible fashion was important. I think if we just tell the American people, it's not time to do anything yet. You gotta continue to stay indoors and do all the things that you were doing back in January. Now, that's not going to work. People are going to just ignore the public health guidance. I think the prudent thing to do is to try to fashion public health guidance that if you have to err on the side of being more conservative, do that, but do it in a way that it can conform to some of what people's aspirations are. And people's aspirations are they want to start re-engaging in their social networks. And so I think that the fact that, the state's still requiring masks, I think masks should be the last thing that we give up. And we haven't given it up yet. It's the easiest intervention to try to reduce risk. So, I think that being on a glide path towards reopening is the prudent thing to do, and do it in a way that you still maintain some level of vigilance because we're not completely out of this.
And what about the New York variant? It seems that right now about a third of COVID cases in Connecticut are that New York variant. What's your perspective on it compared to other variants and the threat that it poses? Yeah, we don't really understand it well. I think that there were a lot of us who were saying that we thought, and frankly, we hoped that the B117 would outcompete 1526, which is that New York variant. What you're seeing, at least in the New York data, and you see it out of Nate's group at Yale as well, is 1526 seems to be outcompeting B117. And I think that there's concern that 1526, half of it carries that 44K mutation that I talked about. That's also in the South African, the Brazilian variant, which seems to reduce vaccine effectiveness and seems to increase the likelihood that people might get reinfected. Although, again, we're not seeing it in the data out of New York with 1526. So I think that there's just more uncertainty about that variant. And so we don't know. We kind of understand 117 at this point, the UK variant. We don't really understand 1526. We haven't seen anything in terms of how that's behaving that suggests that it's reinfecting people or it's piercing vaccine-induced immunity. But I think there's more characteristics of that variant that leave us a little bit uneasy. And you're right, it is becoming the more prevalent strain right now. It's probably about 30 to 40% of infections in New York right now. And it's a lot of the infections in Connecticut as well. Thanks very much. Just one last question for you. What is your perspective on our age-based vaccine rollout, and why do you think other states haven't followed our lead on it?
Well, look, I was advocating an age-based scheme from the outset. I think it's the most efficient way to administer a vaccine schedule that's going to allow you to get vaccine into the most vulnerable part of the community the most quickly. I mean, I think states that adopted sort of hybrid models where they disperse vaccine based on age, but also other criteria. I think what ended up happening in a lot of states where the schemes were just difficult to administer. And when you have a scheme that's difficult to administer, where it's hard to verify eligibility, what ends up happening is you slow down administration at the point of care. I think there needs to be sort of a trade-off in trying to come up with an approach that maximizes the ability to get vaccine into the most vulnerable portion of the population and minimizes the burden on the people who are going to be distributing the vaccine. So you create a scheme that is easy to verify. And the easiest thing to verify is age. And so I think from the outset, having an age-based scheme, while we can sort of look at all the reasons why it's suboptimal in certain aspects, I think all things considered, it was the most optimal approach. I think you've seen the consequences of that in terms of where Connecticut sits right now, among probably top 5 and maybe better than that in terms of the rate of vaccination in the overall population and the coverage of the 65 and above age set.
Thanks very much.
The Day of New London.
Hi, everyone. This is for the governor, for Josh. Can you give an update on how the priority vaccination efforts have been going with the 6 medically high-risk groups outlined last week?
Take it, Josh.
Yeah, we've heard it's gone well. I think most of the hospital providers have provided, access to people with those conditions since last Thursday when we opened up. But more generally, I think we're hearing really good feedback about how this phase has gone. There's a ton of new appointments opening up every day, with 288,000 first dose appointments coming into the state this week. Where anyone who has not yet been able to secure an appointment in the next several weeks, we're confident we'll be able to very shortly.
Thank you.
Connecticut Public Media.
The 35 vaccination bans, those are they only Johnson & Johnson?
Yes, those are going to be doing Johnson & Johnson.
Okay. And are you going to promote where they're going to be with these local health departments? How are people going to know where to find them?
Yes, we're absolutely going to promote them in the local communities when they're scheduled, where they're scheduled. Local partners helping to get the word out. We'll help get the word out at the state level as well.
And last question, for people who haven't been able to secure a vaccine appointment, you mentioned there's going to be over 200,000 new doses coming. So when should those people look for the open appointments? Are those doses that are coming midweek, so maybe Thursday or Friday there's more availability, or is it next week?
Yeah, every provider their schedules and slightly different timing based on, when they get guidance and clarity on what their allocation is going to be, when they get their shipments, how they handle their schedulers and their staffing models. I wish there was a clear guidance. You say, Wednesday morning at 9 o'clock, that's when they all open up. But the reality is it's constantly evolving through the week. So as we always say at the beginning of a new phase, please just be patient, keep checking back in, but rest assured that, everybody's going to be able to get access to an appointment in the next couple of weeks.
CT News Junkie.
Thanks, Max. Governor, with the weather warming up and we're talking about, parades and graduations and outdoor stuff, where do things stand with our state parks and beaches and that sort of thing? What's our capacity restrictions at this point?
Hugh, that's a really good question. Obviously, we kept our parks open throughout the pandemic. I thought it was really great therapy. You could be outside and socially distance, but we had them open, reduced capacity. We did that through the parking lots. So let me talk to Katie Dykes and see what we can think about in terms of capacity. With the warm weather going up, it'd be nice if a few more people could enjoy it. Good point.
Do we know what the capacity restrictions are? Is it 50% there, or?
I believe it's at 50%.
Okay. One other thing I was hoping to ask about, there's a bill, well, there's usually a bill going through the legislature that looks to legalize the direct sale of electric cars, excuse me, for companies that exclude, like Tesla, that kind of thing. Where do you stand on that whole thing?
I think it makes pretty good sense. We're trying to incent people to use electric cars and what that means for the environment. We're giving people financial incentives to do the same. So I'd like to think that all of our dealers can compete with Tesla or anybody else that has a different model, as long as you can be able to buy it right here in the great state of Connecticut.
Okay, thank you.
The Connecticut Mirror.
Hi, everyone. Could you tell us how many people have been vaccinated under the Accelerated Access Initiative, both among the folks with the 5 comorbidities that the state has outlined, and also among people with intellectual or developmental disabilities?
No, Jenna, we're not tracking that. For the 5 high-risk conditions, we're letting the hospitals handle that. As mentioned, just given that this is, everyone's going to have an appointment in a relatively short period of time. As we said, we're letting them handle that. For the developmental disability clinics, we had the first 2 on Friday, and I believe close to 1,000 people were vaccinated between those 2 clinics.
Without tracking those numbers, how confident are you that the initiative is reaching people?
Well, we're in constant dialogue with our hospital systems. They indicate it's going well, that they're filling the reserved appointment slots that they set aside for those individuals. So, if folks have concerns, they can let us know.
And there are reports today that Walgreens has not followed guidance from Pfizer and has been spacing out doses of their vaccine by 4 weeks instead of 3. Is that happening in Connecticut that you've noticed? And how is the state ensuring compliance with the 3-week timetable?
My understanding is that they've corrected that in the meantime. But oftentimes we'll hear concerns from constituents who will reach out to us, and we investigate those. And if we see issues, we'll work to correct them, as we have done throughout the vaccination program. We don't believe that there's widespread issues there.
Thanks.
All right, I'm getting the signal. Let me just say to Scott Gottlieb, our friend, thank you very much for joining us yet again. We're so fortunate you live in Westport, Connecticut, not Schenectady or Boise or something, and your insight's been helpful since the very beginning. And Jenny Doc just reminded me that this is Paraeducator Week. Our kids need you more than ever. It's been a tough year. They're getting back into the school. They're socializing. They're doing their learning, but they also need some friends. Paraeducators are their friends. Thanks, everybody.